Welcome to Health in Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Tonight we're going to take on a topic that as summer closes, many people will notice a change in their life. They'll be undergoing a new adventure, and that adventure is college. This can be a challenging time for both student as well as parent. To help us better understand some of the issues that are facing these students as they go off to college, I've invited Dr. Eric Clark, who is the medical director of Student Health Services at Middle Tennessee State University here in Murfreesboro. So I want to start by saying thank you for being here tonight. Really appreciate you taking the time.
Thank you for inviting me.
First of all, I just want to say it's a beautiful facility. We are filming here at MTSU's Student Health Center. And I have to tell you, y'all have done an amazing job. It's a beautiful place.
Thank you. We feel very blessed to be here.
Well, that's a great place. I want to kind of start off, though. When I was entering college, even 1986, 25 years ago, when I went to Baylor, one of the issues that was always brought up was we had to have a physical exam. And I think a lot of students are wondering, as far as medically, what do I need to do before I enter into college?
Sure, Kelly. For a physical, it's not required for the Tennessee State schools, but it sure is highly recommended. And for a couple of reasons. One, I want to make sure there's not any medical problems that need to be addressed. And the other is the more common issue, vaccinations, to make sure that they're up to date on their vaccinations.
Now, that's great, because that's one of the next question I want to ask you about was vaccinations. A lot of people don't know what vaccines are required in order for me to enter a state university. What are they?
In the state of Tennessee, they require 2 MMR vaccinations, which is measles, mumps, and rubella. They also require 2 chickenpox vaccinations, and that's the varicella vaccine. And then also it's highly recommended for hepatitis B and meningococcal meningitis to get the vaccinations for that. They don't actually have to get them, but they have to sign a waiver form stating they know the risk of not getting those.
Now, I want to kind of come back a little bit. One of the things that people don't realize, mumps is a real big issue, and people who are not vaccinated, oftentimes this can be a real problem with kids getting mumps, and they get into the colleges. Is that right?
They do, and we've had just 1 or 2 cases since I've been here over the last 7 years, but there have been some schools that have had epidemics of it, and those tend to be people who didn't have their second MMR vaccination.
Interesting, because I know it can be a huge problem, because whenever I have anybody with infertility, one of the questions I always ask them was, did you have any kind of virus when you were in college? And they're like, why? Because I'm looking for mumps. And so I know that can be a huge issue in the college dorms.
It can.
The other issue you mentioned I think is very important also is meningitis, because we all, having gone to medical school, we've all heard it. It's always the question.
Sure.
The college student who's at the dorm that develops meningitis. Y'all strongly recommend the meningitis vaccine?
We do. When somebody throws out the term meningitis, thankfully most of them are the viral meningitises, which are still serious but not nearly as problematic. But the bad player is the meningococcal meningitis that comes in this age group, and about 50% of meningococcal meningitis is age 16 to 21, and we can prevent that with a vaccine. And we really encourage students to take that vaccination. They should be getting one from their pediatrician or family practitioner at age 11 to 12. But they need a booster before they come to school. And we can give it to them at MTSU if they'd like, but we sure want to make sure that they get that vaccination.
Interesting, because this is a huge deal. A lot of people don't realize that the 2 places you always hear about at medical school are 1, college dorms, 2, the military. Because you talk about them going off to boot camp and these other things. Now, another issue that I want to bring up, because I think it's important, is a lot of these kids aren't just they're coming in with previous diseases. In other words, they may have asthma, they may have diabetes, and they may have, a lot of them may have congenital heart disease or something unusual in their past. How do you handle those patients as they arrive here at MTSU?
We hope to be able to provide all their primary care while they're here. If they come into us, we'd like to sit down and talk to them about their issues. If it's a problem that we can manage, we'd love to manage it here. Asthma, some of the others that we can do. But there are some that will need specialty referral, and thankfully we're blessed to have a good referral base in this area. We've practiced here long enough that we know who we can trust in the community, and we can set them up with a specialist if they need to. If they've got a heart issue or type 1 diabetic that needs to have an endocrinologist check in every now and then, we can set them up with that here in the community if they would like.
And that's great, because I know a lot of parents are really scared, especially when you got a kid going off to college. You're already intimidated enough, much less a kid going off to college that has diabetes or has some kind of real chronic disorder.
Sure, it's an extra stressor, and if we can help out, we'd like to do that.
And I know the clinic does some of this stuff too, because I know I occasionally will see some of y'all's patients. So the clinic also offers this kind of stuff.
Definitely.
There are many people in the community that can definitely offer the chances. But I think parents need to hear that we're going to take good care of your kids when they come here, and we're going to try and get them the specialists that they need.
Definitely.
The next question I have for you is, you do have community involvement. It's very important that we're involving the community in here. So not every student's going to come here. Someone will use community things, but we do have a lot of stuff here, right?
Right, and that's one thing that people may not realize. At MTSU, we've got a full primary care services here. We can do x-rays, lab. We have a pharmacy on campus, so very few schools have a pharmacy in Tennessee. And if they get sick, we can write them a prescription at a low cost. They can walk right over to the pharmacy on campus and get that filled. And we've got full women's health here from the primary care standpoint. We can even do the basic colposcopy here. So we've got a lot of things to offer for the student here so they don't have to leave the building.
And the nice thing is, I know, because I've seen a number of your patients that come to me, which is great, that the community also has follow-up for y'all. If y'all can't take care of them, we have some great community doctors that can.
And this is a nice medical community. The medical community here is very well established. It's large enough that it has the specialties. If there's a subspecialty we don't have here, we have it in Nashville just up the road, and so that's nice.
The other question I have for you is, a lot of parents are intimidated by this. What advice do you give to the parent who may have somebody that's got some kind of chronic disease? What do you tell them to communicate to y'all before they get here?
We would like them to see their physicians before they come to school, and that's always important. If they can get us the medical records so that we'll know what's going on, that is very helpful to us. We'd be glad to sit down with the parents and the student, or just the student if they want to at the start of the year, or even before when they're coming for one of their customs visits, just to get to know us at the campus. And make sure that we get all our ducks in a row for them when they get here. Right,
because it's so important that when they're here that they're not a surprise. And especially not just for the patient or the student, but also for the parents, because I know it's, like I said, we've mentioned this several times now, it's a real stressor to have somebody with a chronic disease.
And we try to go out of our way to talk to the parent and the student about these issues and anything that we can do to help.
And I have to say, because I interviewed Dr. Spangler last year, and I will tell you one of the things I'm so impressed with is the people that MTSU has gotten. They have really done a good job of getting good physicians, and that's something that this university ought to be proud of, because it is something that we haven't, having gone to Baylor years ago, the health center was not necessarily staffed by physicians, it was community physicians. And it's amazing where we've gone from those times to now. We really do have good quality health care for the students. We'll be right back after these messages. We're going to be joined by the Director of Health Promotions here at MTSU to talk a little bit more about some of the medical issues that are facing this college. We'll be right back after these messages. Welcome back to Health in Today's Woman. Tonight we're discussing college, and we're talking about the transition from high school to college and the problems that many students as well as parents will face. Now, in my first segment, we talked a little bit about the health issues. In this segment, I want to focus a little bit more on some of the social issues and some of the transitional issues that occur. I'm again joined by Dr. Eric Clark, who is the Medical Director for Student Health Services here at MTSU. But I'm blessed to have Lisa Schrader, who is the Director of Health Promotions here at MTSU. And we want to talk a little bit more about some of the transitional phases that go. So Eric, I'm going to kind of start off with you. Now, this is really a major time of transition for many students as well as parents. Not only attending college, but the whole time of just a transition from high school to college.
Sure.
A lot of parents get very concerned because their kids are away for the first time and I'm lonely. How do you kind of start to discern whether we're just having transitional phases or whether we've got something that's even more problematic than that?
Well, I think the big thing is the parents know that child and if that student, and if he is really not bouncing back from the new changes that are occurring with school, then they're going to pick up on it. Because it's exciting to go to school, but it's also a little bit scary too.
Right.
There's personal changes, there's social changes, and the academic changes are pretty significant. And if they're having trouble in one of those arenas, if it's something that's short-term and the parents think, hey, they're going to bounce back through this, then they probably will. But if it's getting more entrenched and they're not bouncing back on there, then they could be getting a little bit of an adjustment disorder, and that's when they need to plug into our system. They can come to student health to talk to us. They could talk to guidance counseling we have on campus, or talk to an academic advisor or someone in the academic department and get plugged into the system and find out where they're having the trouble. When they find out where they're having the trouble, then we'll take action to try to get them on the right path. But if they don't, sometimes we can go all the way to a major depression or something like that, and we need to nip it before it does that, and we can help them with that.
And that's the big issue, is we want to catch them before they ever get to that major depression. And that's kind of, I think a lot of parents are afraid of that. Where do I stop from, when you're talking about transition, there's, it's a new environment, new town, all these kind of things, but when does it make that turn? And I think that's interesting. I think a lot of that is communication. Well, luckily they have somebody like Lisa here who does a great job of promoting what we do here at MTSU, what they do here at MTSU to help those students. Tell me a little bit about some of the things that y'all are doing to try and help with the things that Dr. Clark is talking about before they ever get to that.
Sure, yeah, we actually start as soon as the students are transitioning onto campus. So when they're here for orientation, we have a session where we go over some of the basic mental health resources that are here for students. The parents